My name is Zsolt Illés, and I'm presenting this study about the socioeconomic consequences of neuromyelitis optica spectrum disorder in Denmark. NMOSD, or neuromyelitis optica spectrum disorder, is a severe disease of the central nervous system. It mainly affects the optic nerves, the spinal cord, the brainstem, but any other areas of the brain and the central nervous system can be involved in the pathogenesis. This is caused by a pathological antibody against the main water channel of the brain, that's the aquaporin 4. And if this pathological antibody binds to the target, to aquaporin 4, on astrocytes at the blood-brain barrier, then this will initiate the activation of the complement cascade, and this will destroy the astrocytes. So that's why it's very important to recognize the pathways, because then we can initiate different kind of treatments which actually interact with these pathological mechanisms. NMOSD typically affects the population aged between 40 and 50 years. This is the peak prevalence of the disease regarding the age. Also, it's a little bit more common among females. Actually, it can be up to 8 times more common than in men. And we know also that the geographical distribution of NMOSD is very different. So the prevalence differs regarding the different geographical areas. It's more common among black Africans, 10 times more common than among white people. And also it's more common, about 5 times more common among the Asian population. It's important to treat NMOSD because this is a severe disease of the central nervous system, and the relapses are very severe. Also, when the disease starts, the risk of another relapse is very high in aquaporin 4 seropositive NMOSD. In contrast to other diseases of the central nervous system, if the patient had such a severe relapse, the improvement after the relapse is not so good. Also, we have recently shown that the mortality can be very high in NMOSD. In fact, it's 2.5 times of the matched background population. Also, the mortality rate is around 20% in 10 years, and the life expectancy is 19 years shorter than in the background population. Two treatment types are very, very important in treating NMOSD. One is obviously treating the relapses, because the relapses can be very severe and they do not recover well. And the other treatment is to prevent the relapses, and that's also very, very important. And we know that these treatments actually work very well. They are already phase 3 trial evidences, and these are highly efficient treatments. And we should use very efficient treatment and very early during the disease course, because if we don't treat the relapses and prevent the relapses, then the disability outcome is very fast and very, very bad. We showed already this, and there are a number of other studies which indicate that in fact relapses are the main drivers of disability. So that's why we should really prevent the appearance of relapses. We conducted a socioeconomic study because previously we examined the mortality, and also we know from the literature and also from our studies that NMOSD is a very severe disease. But there is not much data about the socioeconomic consequences, and we're very interested how then this disease affects the family, the patient, and also the society. So previously we have collected and established a research database about all the patients, all the aquaporin 4 seropositive patients in Denmark. So the study period started in 1992 and it was finished in 2020. And the mean follow-up of the patients was about 8.6 years. So in this study, what we did, we selected 10 matched controls for every patient. We examined 65 patients, so it was 650 control person. And during this study period, we examined the annual income loss, Also, we examined the percentage of patients on disability pension and also on flex job, and also social outcomes, for example, divorce and marriage. And then we compared this to different registries in Denmark, which contained all this socioeconomic data. The personal consequences if NMOSD is left untreated are very severe because, as I told, there's a high risk of relapse, especially at the onset of the disease, but all over the disease course. And then what we showed already and other studies, the patient will be severely disabled and the mortality will be very high. And of course, usually we always consider the disability outcome, but we do not consider what is the effect on the family. What is the effect from social points of view on the patient and on the society. And our study really showed that these outcomes can be as severe as the disease outcomes themselves. And during this study, we clearly saw that immediately, even within 1 year after the disease start, the annual income of this population drops by 40%, even within the first year. And we see also that the annual income is also decreasing in this population. So after 2 years, 2/3 of the patients lose the annual income. This goes up to 90% after 6 years. And also within the 2 years or after 2 years, about 1/3 of the patient population is already on disability pension 2 years after the disease onset, and 15% after 2 years have flex job, which means they can work, but this work capability is really reduced. Our data also showed it's very important to prevent the relapses, because especially those patients went on disability pension very early who had multifocal relapses, and the first relapse was multifocal. That means very severe symptoms and affecting different sides of the central nervous system. And also we saw that it's important to start with highly efficient treatment, because those patients who were treated with a highly efficient anti-CD20 treatment, then these socioeconomic outcomes were actually better. We hope that decision makers realize that NMOSD affects also the family and also the person's socioeconomy, not only the physical status. And this is very important because, in fact, if somebody is on disability pension at a young age or on flex job at a young age, then this is a huge burden of the society, and of course it reduces the income within the family very much. So I think it's really a bilateral interest. It's an interest for the patient, it's interest for the society. So it's very important to recognize that NMOSD is a severe disease, should be treated as fast as possible and as good treatment as possible.